Hi, I'm Ruth, physiotherapist at Complete Pilates. When we get new patients in the studio or in our online studio, a question we're often asked is, how often should I be exercising? How many times a week should I be doing Pilates? How many times a week should I be doing other forms of exercise? This is a really important question to consider. Often it's going to depend on you as an individual, what your goals are, what you're hoping to achieve, and also what your baseline is. Where are you starting from? Are you coming in having done no exercise, or are you coming in doing a program of 5 times training a week and you're adding Pilates and other forms of exercise into that? There are some general guidelines as well that are going to apply for everybody we see, no matter really what situation you're in. And those are guidelines set out by the NHS. At Complete, we like to consider Pilates as a component of your wider exercise program and activity program for your general health and fitness. So we need to make sure that you're getting all those components into your weekly, monthly program and doing that in the most effective way for you. I'm going to take a look at some of those components of an effective program and how often you should be doing each of those and how you might be able to fit them into your weekly schedule. So what are the general guidelines that apply to everybody? Well, the NHS in England advises that adults should take part in physical exercise every day. Now, this might not be structured exercise, but it's some sort of physical activity. And some is better than none, and more is even better. Over the course of a week, you should be aiming for 150 minutes of moderate exercise. So that's exercise where you're going to feel that your heart rate is rising, perhaps you're going to feel that you're working some muscles, but it's fairly comfortable. Or you can do 75 minutes of more vigorous exercise. This is going to be exercise where you can perhaps only kind of say a few words up to a sentence because your breathing is hard and your heart rate is going, and you're working your muscles much stronger. And when it comes to working your muscles, the advice is that you should be doing strengthening exercises that target all of the major muscle groups in your body on at least 2 days in the week. This kind of exercise can take all sorts of different forms, both for your kind of moderate to vigorous cardiovascular exercise and for your strengthening exercises. So we'll look at those in a little bit more detail. The other thing to consider in the general guidelines and advice is the variety of exercise. Our bodies respond best to a mixture of methods of exercising, intensities of exercising, and doing different things on a weekly basis and a monthly basis. If you challenge your body in different ways, you're going to get much better results. So let's have a look at those different types of exercise. Firstly, we've got cardiovascular exercise. So what does that mean? Your cardiovascular system is all about your heart, your circulation through your body, and the function of your lungs with that as well. We want to make sure that you're getting effective transfer of oxygen in through your lungs into your circulatory system, which is then well perfused through your body so that your organs, your muscles, and the rest of your body tissues are going to be functioning healthily and effectively. This is the kind of exercise that they're describing in the 150 minutes of moderate exercise in a week. And this is because it has a really positive effect on your general health and fitness. It can have significant effects on disease prevention, things such as heart problems, diabetes, some forms of cancer. The risk of those and the recurrence of those can be significantly reduced if you're taking part in regular exercise. Exercise really is medicine, and if we could give it as a pill, everybody would be taking it, but it just takes that little bit of effort to get it into your weekly program. The other thing that people often think about when they talk about cardiovascular exercise is weight loss, and that's often a goal that people want to achieve. Now, weight loss is a really complex area that's going to be individual for each person as to how they're going to achieve that. But certainly, increasing your movement on a daily basis, increasing your structured exercise is going to help. And if you join that in with a good nutritional program for you and looking at all aspects of your life that might be affecting your weight, then you will get some good results. And again, like you've heard me say before, not only in this blog, but on other blogs on exercise, variety is key. Our bodies are going to respond best to a variety in the types of cardiovascular exercise. So walking, running, swimming, skipping, playing sports, squash, badminton, dancing, all of those things are going to challenge your body in different ways and make your heart and lungs and circulatory system get fitter and healthier in the process. The other thing that you can vary, as well as the method, is actually the intensity. So that's where things like interval sessions, where you work hard for a short time, you rest for a short time, you work hard for a short time, you rest, or maybe circuit classes where you're doing different kinds of exercises through a circuit, or HIIT classes where you're working really hard and then taking short rests. All of those things really push your cardiovascular system to get fitter and get more effective. Again, where you start with this is going to depend on your base level. If you're coming into exercising from really previously not doing any structured exercise at all, you're going to need to work very gradually to increase that and increase your variety, increase the intensity. If you're somebody who's exercising regularly, but perhaps not varying it much, not varying the intensity, you might see a real difference and a real change when you try that. So what about strength training? So there's more and more research coming out to show the benefits of strength training. And this is for everybody. And for groups that perhaps haven't done so much strength training before, or haven't traditionally been encouraged to do so much strength training. So perhaps if you're female and over the age of 35, the benefits of doing strength training are immense. Not only are you going to be able to function better in your daily life, so not only are you going to function better in your daily life or perhaps in your sport, but you're going to protect your bone health. You're going to prevent injury, prevent falls that lead to injury if you're stronger. And also, the more muscle you build, the more calories your body is going to be burning. So strength training actually really helps with weight loss as well. So the research tells us that to see progress with your strength training, you should be doing a minimum of 2 to 3 sessions per week. And we normally advise our patients that they should be doing 3 sessions a week. And again, this is going to depend on your baseline. If you're coming from not doing any strength training at all, you're going to build up to that 2 to 3. If you're coming from doing 2 to 3 sessions and you really want to build more strength, then you can take that up to training 5 times a week. You just need to look at how you're structuring those sessions to maybe work on different parts of your body in different sessions. That's where you need to work with somebody on an individual basis specific to your goals. So on that average of 2 to 3 times a week, you then need to have a program that maybe you work over a month or 6 weeks that is progressive. Our body will easily plateau. If we keep doing the same thing all the time, our body gets used to it and it isn't going to progress any further. So you need to be either increasing the weights you're doing, changing up the exercises so that you're challenging your body in different ways, or maybe changing the reps and sets of the exercises so that you're giving your muscles a different challenge and continuing that progression within your body. Obviously, for some people, they're not looking for progression, they're looking for maintenance. And that's something I'm going to come on to in a moment. At Complete, we see a lot of clients who are pregnant and we get the same kind of question. Does it change if I'm pregnant? Do I need to change what I'm doing? The advice is exactly the same if you're pregnant. You still need to be trying to get 150 minutes of moderate exercise in the week. You can still be strength training. You can still be working on your body. It's definitely going to be more a time of maintenance and looking at your general health and fitness rather than trying to achieve some new goal. But you should still be exercising. Both the Royal College of Midwives and of Gynecologists and Obstetricians recommend exercise through pregnancy. So if you're used to an exercise program when you're pregnant, you can continue with that within the guidelines of what's safe when you're pregnant. So for instance, at around 16 weeks, you might want to reduce the amount of exercise you do lying on your back. This is all about the blood and oxygen supply to the baby and making sure that we maximize that. You might find that there comes a time where impact exercise becomes uncomfortable, such as running. It's safe to run when you're pregnant, but as soon as it feels uncomfortable, you're feeling heaviness through your pelvic floor, then it might be a time to stop running and move on to something more low impact. If you're somebody who normally doesn't really exercise, and now you're thinking about keeping fit and healthy through your pregnancy, you can still build up to that 150 minutes of moderate exercise. We just do it in a gradual way, making sure that we're not overly stressing your body. You can still keep fit and healthy and start an exercise program. Take some specific advice from a physio who's a women's health physio, or perhaps a clinical exercise instructor who has training in pregnancy fitness. So what about Pilates specifically? Again, this is really going to depend on your goals. At Complete, we like to see everybody on a one-to-one basis, whether that's in the studio or online, so that we can really understand you, your body, and your goals. We can then put together a program that's going to be achievable for you and realistic within the rest of your life, and also make sure that we're getting the most effective results from your Pilates. Quite often people will start doing a couple of sessions a week in the studio or with their instructor online, and we'd recommend that you then add in once or twice a week doing some homework that we'll give you. So that really fits into the strength guidelines of doing kind of 3 times a week strength training to really see the results that you want. However, we do have some people who do more than that. We have some people who come into the studio most days a week, and they're just going to be working on different areas of their body or different forms of exercise each time they come in. At the other end of that, there is still benefit to doing 1 session a week. You're still going to be getting some progress. It might just take you a little bit longer. And if you're doing that 1 session a week, you can easily fit that into other forms of exercise, and it's going to benefit those other forms of exercise. So if you come into the Pilates studio and you're working on how your spine and your pelvis and your hip work together and the muscle activation around that, it's going to benefit your gym program when you then are going to do maybe some squats, or you're going to play a sport and play tennis. And you'll see those benefits kind of feeding into the other forms of your exercise. Don't forget about rest and recovery. Rest and recovery is when your body is going to start to make those changes and start to build the muscle that you've been working on in your exercise program. So ideally you want a couple of days a week where you're not doing the harder forms of exercise and you're resting and recovering. That could be active rest, so you can still be doing some walking or maybe a gentle Pilates class or gentle restorative yoga class. But that's going to give your body the chance to recover and rebuild and get stronger. The other thing we see at Complete is people who have injuries. They come to us for rehab of their injuries, and the question is the same. How often should I be exercising? How often should I be doing my specific rehab exercises? And again, that's on an individual basis, but the same rules apply. We still want to be getting you active most days in the week, and then it's going to depend a little bit on how your injury responds. We're going to be guided by pain, any aggravation of your injury, and looking at how we can gradually progress you back to your full normal activity levels. Usually with injury, there's going to be something that you're doing specific for that injury on every day of the week, and then some other more general exercise fitting in around that. So if you're looking at just maintaining your fitness, then those levels still are the same for your general guidance. You want to be active on most days of the week. You want to be achieving that 150 minutes in the week or 75 minutes of more vigorous exercise. But certainly in terms of your strength training, those 2 sessions a week that the NHS advises are going to be enough for you to maintain where your strength is at and keep your fitness at that level. So perhaps a Pilates session in the studio, plus a home-based session or a gym-based strength session, and every day some gentle active exercise that gets your heart and lungs working a little bit. So I hope that helps you with the advice of how many times a week you should be exercising. There are those general guidelines, and then there are specific things that are going to be for you and your goals. If you want to look at a more specific program and goal for you, get in touch. We're here for you. We can see you online or see you in the studio, and make sure that your Pilates training fits in with the rest of your physical exercise, perhaps sports training or more specific gym training that you're doing. We look forward to hearing from you soon.